Hello guys, hope you're all doing good. In this video, I want to discuss about postnatal pregnancy and the features of postmaturity syndrome. So this is going to be a very short video, but details on this will give you an insight on how to manage the postnatal pregnancy and how to avoid it. Okay? Yes. So, postnatal pregnancy. See, generally, pregnancies after 41 weeks till 41 plus 6 weeks is known as late term pregnancy. Okay. So, postnatal pregnancy is one which is more than 42 weeks. So, this is also known as postterm pregnancy or a prolonged pregnancy. Clear? So, this cutoff you should know. Okay, 42 weeks for postterm pregnancy and late term pregnancy means more than 41 weeks till 41 plus 6 weeks. Clear? So, what happens in Indian women is the risk of antenatal death arises 1 week earlier compared to that of the Western population. So, in Indian women, it is ideal to deliver them at least by 41 weeks. Okay? Yes. So, what are the risk factors for postterm pregnancy? The risk is more if she is a primigravida. She has a history of previous postterm pregnancy. And there are risks like older maternal age, obesity, or if there is a genetic predisposition. And considering the gender of the fetus, male fetus have a risk of postterm pregnancy when compared to the female fetus. And fetal disorders like anencephaly, placental sulfatase deficiency, fetal adrenal hypoplasia or insufficiency. Okay, I hope you have understood in the labor chapter that how this hypothalamus and fetal adrenal axis are involved in the labor process. Okay, so hypothalamus is not there to secrete the hormone CRH because if there is an anencephaly, and fetal adrenal gland is not functioning means the cortisol is not produced. Okay, so which is going to induce the labor. Okay, so all these things will lead to postterm pregnancy, and especially about this fetal sulfatase deficiency, this is a X-linked congenital disorder, and this enzyme is responsible for the metabolism of sex steroids that are secreted from the fetal adrenal gland. Okay, before they are being transferred to the maternal circulation. So, any defect in these enzymes will also lead to postterm pregnancy. Clear? Yes. Now, what is the main cause that is happening in the intervention which is leading to postterm pregnancy means? It is inaccurate dating of pregnancy. Very important. Okay. So, inaccurate dating of pregnancy will lead to postterm pregnancy. Okay, we have to estimate the gestational age correctly. Okay, so this should be ideally done in the first trimester itself, but it should be corrected at least before 24 weeks. Okay, so if this is done, then the rate of postterm pregnancy reduces by at least 40%. Clear? Right. The baby will be affected by postmaturity syndrome. Okay, here you will be having features like wrinkled skin, which is peeling and patchy. Then the body will be long and thin because of the wasting, and the baby will be open-eyed, looking unusually alert. It appears old and worried. The nails are long. FGR may be seen. Okay. So, what are the placental problems that we encounter? So, placental problems include, so what are the placental problems that occur in this case of pregnancy? So, there is placental aging that will lead to placental insufficiency, and when the blood flow, nutrients, oxygen supply is reduced, it is going to cause fetal hypoxia. Yes, there is reduced blood flow to the kidneys and there is growth restriction. Clear? So, with this reduced blood flow to the kidneys, what is going to happen is there is reduced urine production, and that will obviously result in, yes, it will result in oligohydramnios again, and this oligohydramnios can also lead to cord compression. And because of this stress like fetal hypoxia and cord compression, it is going to be in a stress that there will be meconium passage prior delivery in utero, and that will even result in meconium aspiration syndrome in the baby. Clear? So, this is the pic of the baby where you are able to see that it is a long as well as it is a thin baby. You are able to see some wrinkles. The baby has opened eyes and it is unusually alert. And if you see the hands, okay, there is wrinkling as well. And here you are able to see some peeling, right? Yes. So, these are the features of postmaturity syndrome. Now, what happens with the placenta? The placenta can have two fates. Number one, there is placental aging. So, this placental aging is going to cause placental insufficiency. That will result in reduced blood flow, oxygen and nutrients to the fetus. So, there is going to be growth restriction and fetal hypoxia. Because of the reduced blood flow to the organs, there is reduced blood flow to the kidneys as well. That is going to result in reduced urine production by the fetus. That will result in oligohydramnios. That will result in cord compression. So, because of the stress like fetal hypoxia and cord compression, there is going to be meconium passage by the fetus and it can even result in meconium aspiration syndrome. Okay? Meconium aspiration syndrome. Then, the another fate of the placenta is that it can have a continued placental function. Okay? So, the function can continue normally. So, if there is a continued placental function for a longer time than the estimated gestational age, it will result in a macrosomic baby. Yes, there is fetal macrosomia. So, that is going to cause difficulty in labor, which will result in a prolonged labor, and there is shoulder dystocia. There are chances of instrumental delivery, cesarean section, as well as birth injury to the fetus as well. Okay. So, what are the maternal risks? Maternal risks include factors like there will be parental anxiety, then there is a need for instrumental delivery and cesarean section. This is also going to be traumatic for the patient, and there is increased chance of postpartum hemorrhage. Okay. So, how does the baby proceed after death? Okay. So, the prognosis after birth, that is the perinatal risks include risks of stillbirth or increased, and there can be need of NICU admission. Already we have seen it can result in meconium aspiration syndrome, and chances of hypoxic ischemic encephalopathy are also increased, and that may result in neonatal convulsions. If suppose there is macrosomia, birth injuries are going to be there, okay, and there can be chances of infections as well as childhood obesity. So, how we are going to manage this? So, management, if it is found in the antepartum period, we should go for stripping that can result in spontaneous labor. So, stripping is going to cause increased production of prostaglandin F2 alpha from the decidua and membranes. So, stripping can be ideally done in a primipara around 39 to 40 weeks and in a multi around 40 weeks of gestational age. Okay? And after stripping, there can be further induction of labor with prostaglandin E2 or prostaglandin E1 gel. Okay? Then, so what about the antenatal surveillance? So, surveillance should have been already started by 40 weeks. You should advise the mother for daily fetal movement count, and you have to assess the modified biophysical profile, which includes ultrasound scan and NST. Especially you have to assess for the feature of oligohydramnios, and NST should be done ideally twice weekly at least. So, when considering the delivery plan, you should start it around 40 weeks if it is a uncomplicated pregnancy. So, this is a short video on postpartum pregnancy. Hope this video has helped you to understand the risks of postnatal pregnancy. Until we meet in the next video, happy learning, take care and bye bye.